The overall goal of this procedure is to accelerate the natural process of follicular atresia in the ovaries, thereby resulting in ovarian failure, depletion of estrogen, and a non-cycling female, a condition that closely mimics menopause. This is accomplished by first administering for 15 to 20 consecutive days the occupational chemical 4-vinylcyclohexene diapoxide, or VCD, which has been shown to specifically target and destroy small primary and primordial ovarian follicles by accelerating their natural process of atresia. The second step is to determine estrous cycle and ovarian cyclicity by vaginal cytology beginning approximately 6 weeks after the start of VCD injections. 15 to 20 days of persistent diestrus or non-cycling must be observed by vaginal cytology to confirm loss of cycling and ovarian failure. The final step is to implement an intervention that may be impacted by menopause or the transition to menopause, such as voluntary cage wheel exercise and cardiac adaptation. Ultimately, voluntary cage wheel activity and cardiac adaptation is used to show whether menopause decreases cage wheel activity.
The main advantage of this technique over existing methods such as ovariectomy is that ovariectomy is a surgical procedure that results in the sudden depletion of estrogen, which is unlike the natural progressive loss of estrogen as occurs during the pre- to postmenopausal transition.
Implications of this technique extend towards therapy of metabolic and cardiovascular disease in postmenopausal women, because postmenopausal women are particularly more susceptible to metabolic syndrome.